The number of patients I think we're going to be able to help in the world is not just tens of millions, but potentially hundreds of millions of people in the world. Because there are 400 million people in the world with coronary disease, and it's the leading cause of death in the world.
HeartFlow is a Redwood City, California-based company started in 2007 by Christopher Zarins and Charles Taylor. HeartFlow's software has been FDA approved to evaluate the symptoms of coronary artery disease, but it has as many skeptics as fans among cardiologists.
What we're doing at HeartFlow is we're taking CT data that is acquired for a patient with suspected heart disease. We take the data, we use deep learning methods, artificial intelligence to extract a very precise mathematical model of the patient's coronary arteries. We simulate blood flow, and we provide this information back to physicians so they can make a decision whether a patient should be best treated with medical therapy, with stents, or possibly surgery. One of the challenges when a patient has chest pain and the doctor suspects that they have coronary artery disease, the physicians have to determine, is this patient, do they really have coronary disease? So trying to make that determination for any patient that comes in, you'd rather not have to take every patient, put wires into their coronary arteries, and to be able to do an invasive test. So the possibility of doing this non-invasively significantly can reduce the risk for the patient and have a better experience than having one of their arteries punctured to do an invasive diagnostic test. But also from a healthcare system perspective, it can be a lot cheaper. It could be a lot less expensive to be able to diagnose coronary artery disease than using conventional methods.
That would be savings that accrue to government payers and to patients who pay out of their own pockets. So we really want to pass the bulk of the savings to the payer and the patient.
Nowadays we have so many more patients, because of the aging of the baby boom generation, so many more patients that will have heart disease, will have coronary artery disease, and as a society, we've got to figure out how to be able to diagnose and treat these patients in a manner that's really safe and you have good patient outcomes, but also is not overly burdensome to the healthcare system.